What happens if, or what are the steps that would unfold if someone comes into the lobby and self-discloses, I'm addicted, I was getting ready to go buy drugs, but something prompted me to come here instead. What are those resources for that?
If somebody walks in my office or in the lobby and says, either I am facing this issue, I'm ready to go out and buy my next fix or whatever the case may be, or if it's a parent that comes in and says, my son or daughter is in this situation, can you help? What we would like to do in the best case scenario, if that individual is here now, we would contact, if it's Monday through Friday, 8 to 5, we would contact our case manager who is right here in the building. We would make that what we call a warm handoff right to that case manager, and they would get them directly into treatment. If it's a situation of an arrest where the officer says, you know what, this is basically a good guy, this is a good girl, we've dealt with them in the past. We know how they got to this situation. We know that they didn't want to be here in the first place. The court system's not helping them. It's a low-level possession. It may be a shoplifting charge. The reason they're shoplifting is for the sole reason of supplying their addiction. Then we can, again, make that warm handoff. At that point, they're not facing a criminal charge. If they fail to follow up in their treatment in that 14-day period, then we can go back and charge for that crime. So there is a little bit of obviously there's a carrot there to provide treatment for the individual, but there's also that stick where if they don't follow through on treatment, then we can go back and charge. Now that social referral, that person just walking in the lobby, that mom that's coming in here, we will get them into treatment. If they decide that they're there and want to walk away, that's between them and their treatment provider. We're not involved in that aspect of it at all.
So our program, there's two distinct features that we had set up here when we first started this. One was that it didn't matter what your drug of choice was. My philosophy was that if you're here to help someone, then those barriers shouldn't be in play. So it doesn't matter whether you have an alcohol problem or a cocaine problem or a meth problem or a heroin problem, we're going to help. The second one was that there's no residency requirements. So you don't have to be from Nashville or Nash County or even the state of North Carolina, because we've had individuals from all over come here. Individual walks in the front door, and then I do an initial assessment with them, and that lasts anywhere from 15 to 20 minutes at the most. The most intrusive question we ask them is, when was the last time you used? Because if you have used recently, then you're probably going to need to go through a detox program. If you haven't used in, say, 3 or 4 days, then your body's probably already detoxed, and we can go to the next step. But if they do need detox, then I carry them to the hospital. We get them checked in and triaged, and then they get a behavioral health assessment. And from there, they determine whether they need detox or not. If they do, they go to detox, and then while they're there for that 4 or 6 days, then we work on placing them somewhere in a long-term residential program. If they don't need detox, or they don't meet criteria for detox, then there are other options such as outpatient, and we call our local management entity to set that up. It could be medicated assisted treatment, methadone, Suboxone, Vivitrol, those kind of things. And so there's a lot of other options for people to get into recovery.
We also initiated an overdose follow-up program where we are being notified and responding to every single overdose in the city of Waynesville. And before, we would only really get notified if a fatality had occurred there at the scene. And if they were transported, we really never saw that. Working with our EMS, local EMS, we are being notified on every single overdose. The officers are responding. They're doing an overdose report form, and that report form is used in 2 ways. Number one is enforcement. Those that are on the scene at the time of the overdose are often willing to give us information about where those drugs came from. So that overdose form goes to the investigators to find out who's supplying those drugs. So it's used as an enforcement tool. But then that form is also going to a lieutenant here in the department, and they're doing overdose follow-up. So when that individual comes back to the house, either from the hospital or wherever, we are having peer support people meet with, along with an officer initially, meet with that person and give them resources that are available to try to get them into treatment. And again, we don't want to have to respond to the same house over and over and over. We've administered Narcan to the same individual 4 or 5 times. We don't want to. We want to break that cycle. And obviously, that cycle is not being broken in the criminal justice system on those lower end crimes. So if we can get them into treatment and to stop that cycle, then that's what we're going to do.
So with your prosecutor, has it helped with pending cases or any cases?
Yeah, there's it's interesting because we had the district attorney's backing initially, the local prosecutors, his team, have helped a lot in individuals that have, let's say they have a possession charge of heroin, which is a felony no matter what amount. They can defer charges, or they can make it a plea to a lesser charge, or they can make it a part of their probation that they go and complete training. So it really, depending on the circumstances, and each one of those cases have to be looked at individually, but they've done that for us in a number of times.
We get those individuals that, again, find themselves just trying to support a habit based on they got there from maybe a situation where they never asked to be addicted to this, but they had that car crash 3 years ago. We've stopped professionals. We've stopped people in every single profession career out here. Again, remember, it's an equal opportunity addictor, but from that car crash 3 years ago, now they're buying pills from us in the CVS parking lot. Is the criminal justice system going to solve that problem? Is it going to stop that cycle? For a long time, we just keep arresting the same people over and over and over and with the same outcome. So we're hoping that lead with certain individuals. And again, we talked about that community buy-in. If we've got that guy selling drugs down here on the corner to our school kids, number one, we're not going to put that individual, we're going to put that person in jail. But if we try to divert that individual, the community wouldn't accept that. And we understand that. So we wanted that community support.